Hi, I'm Dr. Devayani Barve. I'm a plastic and cosmetic surgeon and I practice in Mumbai. There has been a lot of talk and a lot of discussion the worldwide about weight gain, weight loss, and the problems which people who are on the heavier side face. This has become a huge topic for discussion in the last few years and especially in the last few months because of a lot of well-known people losing weight, because of a lot of well-known people talking about weight loss and their struggles with it, and because of availability of weight loss drugs. Now, weight gain has always been a concern since time immemorial. People have always associated being slim with being beautiful. Though it is partially correct, our bodies were designed in a certain way by nature so that they look proportionate, and what is considered aesthetically good looking is generally what is in proportion. But having a certain BMI or having a certain target weight does not mean you're healthy or that you're beautiful. Being thin is beauty. That is not correct. This is a myth which needs to be broken. However, that discussion is for a separate video. In this video, I'll talk to you about the social pressures and the peer pressure which surrounds all of us when it comes to looking a certain way. Media, social media, television, movies have always shown us that looking slim and trim is the way to look beautiful. So naturally, people feel pressured to lose weight, to lose fat, to have a certain body shape and to fit into certain clothes. Now, rapid weight loss and adopting crazy diets, different kinds of crazy exercises, depriving yourself of certain kinds of foods, or taking certain kinds of stimulants is fraught with danger, and it can cause a lot of nutritional deficiencies, it can cause bone loss, it can cause muscle loss, and it can cause you to become weaker and age faster. That is a fact which we all know. However, we still fall prey to these fancy diets which make us a few kilos lighter in a few weeks. The way in which weight loss has evolved has reached a new point in today's day and age. There are weight loss medications available which are now available in India as well, such as Ozempic, Mounjaro, and these work to reduce your weight gradually. However, whether you're a candidate for these drugs or not and whether you need to take them or not is a decision which has to be made with caution. These are not like health boosters or vitamins which can be just popped once a week and you will achieve your healthy weight. These are drugs which work on your appetite, which will change the way you look at food, which will affect your mental health also in some way, and also have other side effects if they are not used properly. These drugs act in a way that was developed for diabetic patients. So they change the way your body reacts to glucose. It will make you want food less. Now, this food addiction is something which has been identified recently, and people have been talking about it for years, but now they are talking about it more openly. Food addiction is something which means that food is always on your mind and you can't stop thinking about it. These drugs work in such a way that they reduce your want or your craving for food. So eventually they act by reducing your food intake. Now, the people who don't suffer from food addiction or who have always been slim, well, we call them blessed and we call them that those people have a great BMI. But it also works in other ways. That is, they don't think about food all the time. Whereas people who have food addiction think about food all the time and think about eating. So depriving themselves of food and doing diets and controlling their weight is a very, very difficult task which they have to surmount. So that's where these drugs come in. And if you are in one of these categories, then you may be a candidate for weight loss medication. However, please remember that do not take it just because your friend took it or just because somebody told you. It's very easy, you will lose weight with it. Make sure you see a practitioner who knows how to administer these drugs and knows how to follow you up for the same. The other options which have always been there for weight loss include bariatric surgery, which essentially reduces the size of your stomach or reduces the absorbing capacity of your intestines and reduces the calorie intake. And the last, not exactly on this radar, but also on the periphery somewhere, is liposuction. So if you have localized pockets of fat or you just want to lose a little bit from a particular area, then liposuction is the procedure for you. Overall fat loss has always worked better with either drugs or some kind of a intestinal altering surgery. These surgeries work well and these medications also work well, but you have to take them under supervision. Always remember that overall, struggling with weight or weight gain or struggling with the concept of losing weight is not just you. There are millions of people struggling with that. Some are able to achieve it, some are not able to achieve it. However, now that technology has advanced, we have more and more drugs and more facilities available by which you can achieve what you've been trying to achieve safely and in a monitored way. So make sure that you consult a registered medical practitioner who knows how to handle these medications so your health is in good hands. If you found this video helpful, please don't forget to like, share and subscribe for future such content. Thank you for watching.